Good afternoon, everyone. My name is Caden Bacata, and before I start, I just want to thank you all sincerely for taking time out of your day to hear what I have to say. Know that I stand here to represent the students of your facility and to speak as a voice for the majority of them. You see, this school has been upheld in the Mounds Public School District for 65 years. It has been a second home to hundreds of thousands of students since 1955, and currently, actually, upholds one of the highest GPA averages in all the schools in Minnesota, ranking at number 5, I believe. And you should all be proud of that. Really, that is no easy feat to accomplish that. This being acknowledged, there is no school or building that doesn't stand that also doesn't cast a shadow, and Mounds View is no exception. There's an underlying pandemic that has plagued this school for an undisclosed amount of years, hidden to most onlookers, and staying vastly under the radar, unlike the most recent COVID-19 outbreak. You see, ask any high schooler, ages ranging from 16 to 19, or maybe older, or maybe younger, whether they've battled a period in their life in which they have faced depression, or mental issues, being mentally unhealthy, and odds are you'll get a positive or, I suppose, negative answer. A study presented by the Minnesota Department of Health depicts a relatively linear line that represents the incline and decline of suicide rates committed by teenagers since 1991. That is, it remains linear until the year of 2016, when it spikes and increases by roughly 200,000 since the previous 2 years. That almost matches the number of deaths caused by accidental injuries for teenagers. Now, I want you to keep this statistic in mind when I say that in the time spanning January 1st, 2016 to April 7th, 2016, 4 students from Mounds View High School took their own lives. I want everyone to stop and to think about that. 4 students. Now, not as a statistic or as a number, but understand and know that those 4 students were somebody's babies, somebody's pride and joy, and, well, somebody's friend. However, those 4 students decided that their issues couldn't have been overcome, and they did the one thing that you can't undo. This, however, doesn't come into play exclusively after 2016. There were many warning signs and points and calls to action spanning years, many years before that may have gone unnoticed or unchecked. You see, a blog formed in 2010 was created to mourn the death of a freshman at Mounds View High School. As of May 2010, this student took his own life. This blogger also expressed that this wasn't the first suicide that year. Skip to 2 years later, and another blog created by the same person is made, mourning another suicide at Mounds View High School. Another student in 2012 took their own life. What issues in a high schooler's life could convince them that it simply wasn't worth it? I asked a broad spectrum of former Mounds View students that exact question. And as an anonymous student exclaims, it's a bit of a stigma in our school. In my class, we had 9 people get a perfect ACT score. There's just that expectation that you're going to be in all AP classes and you're going to get a 4.0 GPA. I asked them to elaborate on that, and they said, to sum it up, it's basically the feeling of being inadequate, if not perfect. For many students of Mounds View High School, receiving good grades was not and is not accomplished by self-motivation, but rather the fear of expectation. In their minds, if you don't live up to the expectation of a model student, then there's not much else for them to live up for. Now, I don't dismiss that Mounds View does have a current strategy of tackling the issue of mental health, and that is to outsource the solution, to advise students and support them in reaching out to facilities that focus on mental health and don't double as a high school. That sounds like a solid plan to me. Making sure that students who need professional help can be aided in receiving it. Well, while that is very much a solid plan, many of the students who I interviewed admitted that they could have used professional help, be it counseling or therapy or, just help for their mental state in their high school years. I asked them if Mounds View ever served as a solace for that very need, and the only student who sought help in Mounds View said that it came in the form of stickers on the floor that said, "Spread positivity." And that's it. Nothing else. Now, in order to fit a healthy student-to-counselor ratio, Mounds View would be advised to have 7 individual full-time therapists or student counselors. And the current number is, as many of you know, 1. That is 1 full-time student counselor for 1,794 students who may need help. There is a blatant disconnect here. I do, however, see a solution. Many Mounds View high schoolers are unaware that their school has a platform to help them seek mental guidance, and I believe that the simple act of having a mandatory presentation in the first week of school informing students of how they may seek counseling could prove to see a rise in students reaching out for help. A year and a half ago, Mounds View had also received a budget of $49 million in order to renovate the school. This money has gone to expand the school's quarters, to add new hallways and field houses. And I believe if some of that financial buff could go to hiring new staff to perhaps fill in the hallways that are being built, I believe that if those staff are trained and serve as full-time student counselors, being 7 of them, I believe that Mounds View could experience a massive turnaround in their students' mental state, both outsourcing and housing that extra step and that extra help for students. I believe if that idea, those 2 ideas, could be put into practice, that it would literally save lives and allow the dozens of suicides and thousands of cases of depression throughout the school to not exist in vain.